Hafa Day and good morning, everyone. Welcome to the Guam Congress Building. The Committee on Health, Land, Justice, and Culture is now called to order. Today's Monday, January 30, 2023. The time is 9:03 a.m. In compliance with the open government law, notices for this public hearing were published in the Guam Daily Post and on the Government of Guam Public Notice website on Monday, January 23 and Friday, January 27, 2023. This hearing is being live streamed on the Guam Legislature's YouTube channel. Notices were also disseminated via email to all senators and all main media broadcasting outlets on those same days. Individuals testifying shall first be recognized by the chair before speaking. We have one agenda item this morning, and that is Bill number 10-37, introduced by myself, Therese M. Terlaje, and Senator Chris Barnett. It's an act relative to authorizing law enforcement, first responders, and community organizations access to NALOXONE to prevent opioid overdose, including fentanyl, to be known as the Guam Opioid Overdose Prevention Act of 2023, by adding a new Chapter 16 to Division 1, Title 10, Guam Code Annotated. This bill was introduced on January 18, 2023, and referred to the Committee on Health, Land, Justice, and Culture on January 18, 2023. I'd like to thank my colleagues for being here this morning, beginning with Senator Chris Duenas, Senator Jesse Lujan, Senator Chris Barnett, Senator Tom Fisher, Senator Telo Taitigui. And we're all excited because this is our first public hearing for the term. So before we hear from those signed up, as the prime sponsor, I will introduce the bill briefly. This legislation was received from the Office of the Attorney General on Wednesday, December 28, this is in the last term, which was discussed at the Opioid Recovery Advisory Council meeting on October 18, 2022, and again at the latest meeting on December 2022. I'm a member of that council, so I was able to hear from those at the meeting, their concerns and the urgency of passing this type of legislation. The bill was previously transmitted to the Public Safety Chair, but was not able to be done last term, so we're proceeding with it as the first bill this term. The Opioid Recovery Advisory Council was established in the 36th Guam Legislature through Public Law 3664. It was an advisory body established to determine the allocation or expenditures of funds from the litigation efforts of the Office of the Attorney General from pharmaceutical companies, and consists of 11 members, 9 voting members, 1 non-voting chairperson, which is the AG. Bill number 10-37, introduced by myself and co-sponsored by Senator Barnett, authorizes law enforcement, first responders, and community organizations to have access to naloxone, grants prescriptive authority to healthcare professionals, as well as dispensing and distributing authority to pharmacists and employees or volunteers of community-based organizations. There will also be civil and criminal liability immunity granted to healthcare professionals and employees or volunteers of a community-based organization who prescribe, dispense, or distribute opioid antagonists unless their action represents recklessness, gross negligence, or distribute opioid antagonists to unqualified individuals. So naloxone is an opioid antagonist. Opioid antagonists bind to opioid receptors to block the effects of opioids, which can stop opioid overdoses if injected or inhaled. According to the National Institute on Drug Abuse, quote, overdose education and naloxone distribution has been shown to increase the reversal of potentially fatal overdoses. One study showed opioid overdose death rates to be 27 to 46% lower in communities where the overdose education and naloxone distribution was implemented. This legislation is patterned after model legislation by Legislative Analysis and Public Policy Association, or LAPA, which would also empower individuals, first responders, and community-based organizations to have a proactive approach to responding to overdoses and ensuring we save the lives within our communities. Training is required and essential in ensuring that those administering these opioid antagonists are correctly doing so. To put into perspective, someone who's overdosing may stop breathing or their breathing is slow and labored, meaning that they need oxygen. Naloxone may take a few minutes to start working, so you need to wait about 3 minutes for it to take effect. While this is occurring, you would need to check if they are breathing, and if you cannot hear them breathe or their breath sounds shallow, you would need to provide rescue breaths. If the person wakes up, they may have opioid withdrawal symptoms such as chills, nausea, and muscle aches. And in addition to this, the person may be scared, nervous, or restless. And so there is still the need for continued response and continued care for these people, but this is just a drug to prevent the full effects of the opioid from taking effect in the body if distributed on time. So for the record, in addition to stakeholders, invitations to provide feedback were sent to the following. I want to thank you all for being here. To members of the Opioid Recovery Advisory Council, which is chaired by the Attorney General of Guam, the Guam Behavioral Health and Wellness Center, also a member of the council, Guam Board of Medical Examiners, the Emergency Medical Services Commission, the Salvation Army Lighthouse Recovery Center, the Oasis Empowerment Center, the Guam Medical Society, Mayor's Council of Guam, which is also a member of the Opioid Recovery Advisory Council, the Department of Public Health and Social Services, Bureau of Social Services Administration, well, the whole Department of Public Health, which is a member of the Opioid Council as well, the Public Defender Service Corporation, the Guam Memorial Hospital Authority, the Guam Bar Association, Sanctuary Inc., the Department of Corrections, Department of Youth Affairs, other members of the council, including the administrator of the courts, the Magahagan Guahan's appointee, and the Speaker of the Legislature's appointee, and the Minority Leader of the Legislature's appointee. And of course, we published notice as detailed earlier. So we'll now accept testimony from those on the panel. I want to thank all of those who signed up to testify this morning. We also have written testimony from Ms. Danielle T. Rossetti, Administrator of the Courts at the Judiciary of Guam, from Therese C. Areola, Director, Guam Behavioral Health and Wellness Center, Mayor Anthony P. Chargaloff Jr., Mayor of Inalahan, and Attorney Jeremiah Luther, Legal Counsel, Guam Memorial Hospital, but he's also here in person. So there is an esteemed panel of presenters today. If I may begin, I would like to invite the Attorney General of Guam, if he would, to please have a seat at the table. Mr. Fred Nishihira, also at the Attorney General's office, one of the litigators of the opioid cases. Mr. Chief Steve Ignacio from the Guam Police Department. Mayor Jesse Allett, President of the Mayor's Council of Guam. Deputy Director Laurent Duenas of the Department of Public Health and Social Services. Chief Robert Camacho of the Department of Corrections. Jeremiah Luther of the Guam Memorial Hospital Association. I'm sorry we can't fit everyone at the table at this moment, but we will get to you as soon as we can. I'd also like to acknowledge the presence of our Vice Chair, Senator Joanne Brown. All right, so we will begin. We'll begin with the Attorney General's office. Attorney General Moylan, you may proceed. Wait, please turn on the microphone. Thank you.
Good morning, Madam Speaker, Vice Chair Barnett.
If you could pull the mic closer. Yeah, thank you.
As well as all other senators. Thank you for this opportunity to testify on Bill 1037. I brought Assistant Attorney General Fred Nishihira here to contribute to the discussions on this. I just wanted to open by saying that, drugs on Guam, the fentanyl epidemic might be coming based upon what we see in the United States. I think everybody knows how important it is to have immediate treatment for anyone that's exposed to it. Right now at the office, we're looking not at just the victims that take the fentanyl, but also the first responders that can be affected by just a small quantity that's airborne. Just as recently as last week, we're also talking about the dogs, the canines, that can be killed by beginning to sniff the fentanyl. So we're in discussions with GPD and other law enforcement agencies to see what type of drug can be used to also protect the animals that may be attempting to detect it. From the AG's office perspective, this legislation is very appropriate, and we request the immediate and timely passage of it. Mr. Nishihara will be talking further about the particulars. One of the highlights that we had was that because of the settlement agreement, the ability to actually get the pharmaceutical product can be given in lieu of money by an actual manufacturer of that antidote. But on Guam, we don't have a entity to receive it because it's on a controlled substance type of list. I respectfully request the senators, the committee, to consider having an exception, so maybe mental health or Guam behavioral health might be able to accept the product without being in violation of our statutes. I believe there is a section that I was kind of looking at on the last part, 16109, that might be a good way to make an exception for some entity within the government to accept this type of antidote. But having said that, Madam Speaker, may I defer to Mr. Nishihara for further comments on our office's position. Thank you.
Thank you, Attorney General. Attorney Nishihara.
Thank you, Madam Speaker. And we will also submit written testimony, formal written testimony within 10 days if that's okay as well, sometime. I know the Speaker had mentioned that there was additional legislation for our office to consider, so we would take a look and comment on that as well. But perhaps maybe I can start by just saying, you know, with every piece of legislation, because what you will hear there are some concerns with the drug itself, naloxone. However, with any legislation, right, you always weigh the benefit compared to the risk, and in this case, we think it's much more beneficial to the community of Guam to move forward and pass the law. Pass the bill as written right now. So I'll work with the AG here, and we'll submit a more formal one. One of the good things I can comment on, just like you said, Speaker, the Opioid Council is very involved with this too, and supportive of this piece of legislation. One of the requirements of the proposed law is that training is required, and that's exactly what the council could use some of the money for. So if this is passed into law, the council then can consider moving some of that money into the training that is required for some of this law. So it's very good, goes hand in hand. We could move forward quickly. I believe the AG has in either late March or April to make the decision whether we will receive additional funds or the naloxone or the product itself. In other words, we don't even have a procurement problem. If we can get this law passed timely, the AG will be able to make the decision and get the product on Guam. I was saying hopefully as early as summer. I know that seems like a long way away, but it's not just Guam. It'd be the other 50 jurisdictions or so too that are going to be receiving products. So thank you for your time.
Thank you. Before we proceed, I'd like to read excerpts from the testimony of the Guam Behavioral Health and Wellness Center. I think it's appropriate right now. I'm going to just do the meat of it. It's in that light, the Guam Behavioral Health and Wellness Center had applied for the State Opioid Response SOR grant from the Substance Abuse and Mental Health Services Administration, SAMHSA. This grant requires behavioral health to purchase and distribute naloxone to prevent opioid overdose-related deaths and to also purchase fentanyl strips for consumers to utilize if needed. Since 2018, GBHWC, or Behavioral Health, has purchased and distributed naloxone to our peer specialists who have been trained to use naloxone spray kits and plans to distribute 10 naloxone spray kits to other substance use disorder treatment centers on Guam, including Salvation Army Lighthouse, with consumers in the residential treatment center who have an opioid use disorders. In regards to training, the original plan in 2018 was to provide mental health first aid training for first responders on the island and to incorporate the training for the naloxone spray kits and distribute the kits accordingly. During 2019 through 2021, behavioral health was not able to provide the training due to pandemic. And looking forward, behavioral health plans to continue to offer training, and this would meet the requirements under Section 16107 of the proposed bill. In addition to supporting the bill, they would like the following recommendations. They recommend the inclusion of first responders under the immunity section, and they recommend that behavioral health be the sole provider of training and the Department of Public Health and Social Services be removed as training providers, and I believe this is consistent with public health testimony as well. Mayor Alec.
Good morning, Speaker and Senators. As a member of the Opioid Advisory Council, the Mayor's Council is in support of Bill 1037. Our thoughts is that the naloxone, it should be available at the widest, as wide as possible, as much as possible, and as quickly as possible if the resident should need it. Training, of course, is important for us, and so those first responders and the community-based organizations, we know and we hope that they will be properly trained to administer naloxone to our residents if it should be necessary. And so without any further research, we do have to say that we still are in support of Bill 10-37. Thank you.
Thank you, President. Mayor Alec.
Thank you. And if I may ask to be excused as well.
Thank you.
Thank you.
You're, yes, of course. And Chief Ignacio, and I want to thank you, Chief, for it was a letter submitted, I failed to say, a letter submitted jointly by the AG and you, the Chief of Police, proposing this legislation. So, Chief Ignacio.
Good morning. I'm Stephen Ignacio, the Chief of Police of the Guam Police Department, Speaker and Senators of the 37th Guam Legislature. Good morning. I'm here to provide testimony, oral testimony in support of Bill 10-37. Currently, the Guam Police Department, we were not aware at the time that we had placed an order that naloxone, or what we call Narcan, was considered a Schedule II, and it was through my discussions with then AG Camacho that he made us aware that the possession of Narcan was technically, by law, with the Guam Police Department, not legal. And so what had happened is that we then had to pull our Narcan off the streets and put it back on the shelves. Unfortunately, when something as important as Narcan doesn't get into the hands of police officers, and the police officers are exposed to or run into a case or called to a case of an opioid overdose, this life-saving sprays or opioid antagonists sit on a shelf, and we can't disperse them to our officers on the street in current form. So we like AG Moylan said, we urge the passage of this bill so that it can be placed into law and get these life-saving opioid antagonists out to the field where the officers need it. I say that because we already have confirmed seizures of fentanyl on the island. I have gotten off the phone with Customs and Quarantine Director Ike Paredo, and he confirmed that Customs has seized fentanyl. In our interactions with the federal agencies, we do have another confirmed seizure of fentanyl on the island with the Federal Law Enforcement Agency. We know of at least 2 cases on Guam of fentanyl overdose. So, the thought that it might be here, I think we just need to deal with the fact that it has made its way to Guam. It's been seized and it actually made it out to the streets, and we have an active investigation into the opioid scene as well, or the fentanyl scene. So we stand in support of Bill 10-37. We don't need these sitting on shelves. We need them out on the streets into the hands of the officers. I concur in my discussion with Director Ariola that we can receive proper training from the Guam Behavioral Health and Wellness Center. In addition to that, though, if you look at this box on Narcan, it actually walks you through step by step on the proper administration of Narcan. And so with that, Senators and Speakers, Speaker, I submit my oral testimony in support of Bill 10-37.
Thank you very much, Chief. Before we proceed, can you just clarify, you have supply already on your shelves?
Yes,
These are still good and can be sent out if this bill's passed?
Absolutely. So we have about 100 boxes already in stock. We had purchased them, and and this was kind of a surprise to me because it was delivered to the Guam Police Department, and we didn't have a standing order for prescription, and so we placed the order. It came in and it was delivered. We spent $7,000 in in these Narcan nasal sprays. In addition to that, we've also built capacity within the Guam Police Department because of our experience with fentanyl in the streets and other unknown substances. We've actually purchased 3 true narc field testing equipment to help us detect possible fentanyl in our investigations.
How does that work?
It's just an instrument that you take out in the field and you test what you believe might be fentanyl, powdery substances, and it will give you a presumptive field test. It's pretty much the same thing that you would do with methamphetamine. You take you take what you suspect is meth, and you put it into this,
Okay.
This pouch that you break the vials, and it'll give you a reaction. So it's the same concept.
Thank you. Would you be willing to let us see the Narcan that some of the senators are requesting to see
Absolutely.
the box? Or thank you. Thank you, Chief. I'd like to invite John Morrison, the Deputy Director Public Defender, to join us on the panel since we have an open seat. And we'll proceed now with Public Health. Deputy Director.
Buenas, Speaker Terlaje and committee members. I'm here representing the director who right now is with the Region 9 representatives, and so I will give the testimony. It's also submitted as part of the Health Professional Licensing Office in consultation with them. The Department of Public Health and Social Services supports the intent of Bill 10-17, a Prevention Act. The bill notes the United States is in the midst of the worst opioid epidemic in history, as mentioned earlier. According to the Centers for Disease Control, the number of opioid drug overdose deaths in the U.S. has increased by 30% from 2019 to 2020. While these numbers do not reflect our local drug of choice situation, the Department of Public Health and Social Services supports legislation that promotes prevention, education, and training of our local partners and community members to be prepared in the event our local situation evolves and mirrors what is happening in the U.S. This proactive measure of prevention prepares our community to respond to what may be a local crisis, and given our experience with the COVID-19, being prepared is key to be able to respond timely, in this case, administering naloxone or Narcan. Naloxone is a life-saving drug that can help reverse the effects of opioid overdose, and Department of Public Health and Social Services supports efforts to make this emergency treatment more readily available and more accessible to individuals at risk of experiencing an opioid overdose. Naloxone is not a controlled substance. Thus, the restrictions and prohibitions associated with scheduled substances in the Guam's Uniform Controlled Substances Act would not apply to this particular drug. However, being it is a drug, only those approved by the U.S. Food and Drug Administration and meeting the requirements set forth in the Guam Food, Drug, and Cosmetic Act, Title 10, Guam Code Annotated, Chapter 40, should be allowed. The administration, the bill makes no mention of a route or administration of naloxone. This is important in order to distinguish the types of administration and the delegation of responsibilities. Narcan may be administered intranasally, intravenously, intramuscularly, or subcutaneously. The most rapid onset of action is achieved by intravenous administration, which is recommended in emergency situation. It is our recommendation that healthcare providers and emergency medical technician, EMTs, be able to administer naloxone intravenously, intranasally, intramuscularly, or down the endotracheal tube. Absent healthcare training, all others administer naloxone intranasally by way of a nasal spray. I'm sorry, the masses. Training and education. By virtue of a healthcare provider's training and profession, medication administration is adherent. For training of non-healthcare providers, it is our recommendation that Guam Behavioral Health and Wellness Center be the agency designated to provide this training, as this agency already has this program in place. Further, the Department of Public Health and Social Services and the Guam Behavioral Health and Wellness Center are in agreement that the Guam Behavioral Health and Wellness Center be the agency responsible for training as proposed in Section 16107. In summary, naloxone quickly reverses an overdose by blocking the effects of opioids. It can restore normal breathing within 2 to 3 minutes in a person whose breath has slowed or even stopped as a result of opioid overdose. Naloxone is safe. There is no evidence of significant adverse reactions to naloxone. The risk that someone overdosing on opioids will have a serious adverse reaction to naloxone is far less than their risk of dying from an overdose. Naloxone works if a person has opioids in their system and has no harmful effect if opioids are absent. Again, incorporating the recommendations made by the Department of Public Health and Social Services, the department supports the intent of Bill 10-347. Zinnia Pacina, MSN, RN, Administrator, Health Professional Licensing Office, and Laurent S.F. Duenas, MPH, BSN, Deputy Director. Thank you.
Thank you, Director. We'll now hear from Chief Camacho, Department of Corrections.
Good morning, Madam Speaker and Senators. We are in total support of Bill 1037 and echoing the same sentiments with our previous speakers, that of course this is a concern of ours. A couple of months ago we had a briefing with the FDA, and they did tell us about the reactions of the fentanyl, if it is found in our premises and what might happen. So definitely we are in support. This just makes sense. It's proactive. And it's also speaking on behalf of the Post Commission as an executive director, I think overall we'll probably have the best support of this throughout our law enforcement agencies. I won't speak on their behalf, but just as the Post Executive Director. So it is a concern for us, and of course we do have our issues with drugs infiltrating into our facility, and so this will be a great prevention to save lives of our officers and prisoners if necessary.
Thank you very much, Chief. Mr. Attorney Luther from the Guam Memorial Hospital.
Thank you, Madam Speaker, and thank you, members of the legislature. I've prepared a statement representing the position of Guam Memorial Hospital, which is generally in support of this bill and any other bill that would prevent an unnecessary death by an opioid overdose or any other drug overdose here on Guam. Without reading that entire statement, which the members of the Senate have, generally, to sum up, the research that I've done in this area is that these types of laws have been passed in all 50 states in the District of Columbia, and there is statistical evidence showing that by placing naloxone or any other opioid antagonist into the hands of the people who are most likely to be able to use it the fastest and to the greatest effectiveness, namely first responders, in certain instances family members, and community members who may be close to a person with an opioid addiction, we can significantly reduce the mortality rate from opioid overdoses and other related related to fentanyl, hydrocodone, and other similar drugs. And so GMHA stands with the other members here that are testifying today to support the goals of this legislation. Obviously, Guam Memorial Hospital is a very large organization. There is some trepidation about putting a drug into the hands of let me say it again then. There is some trepidation from healthcare professionals in GMH about placing a drug into the hands of non-trained individuals or individuals who don't have extensive medical training. And so I wanted to express that concern. And it should not be minimized that this is a pretty extreme step, but as I stated in my statement, this is necessary because the downside is that we have unnecessary deaths across the board. My home state of Tennessee has been ravaged by opioid overdoses. It's one of the worst states in America for what I believe are preventable deaths, and this is a good step, a preventative measure, because like many other members here on the panel, I believe that the opioid crisis has not fully reached Guam, but it is inevitable. Fentanyl is cheap, it is easy to obtain, it is now being used in drugs that drug users wouldn't normally expect it to appear, and that is the great risk, I believe, here to Guam, is that a lifetime drug user, an addict, gets a drug that they don't know has been laced with fentanyl and ends up in the emergency room or, God forbid, in the morgue. And so we support this we support this bill with some changes. I've outlined the areas of concern that the physicians have. I support the Guam Behavioral Health and Wellness's sentiment that there should be the inclusion of first responders in the immunity section specifically, and I would just ask that the sections of the legislation that I've raised just take another look at the actual text. Thank you very much.
Thank you very much, Attorney Luther, for Guam Memorial Hospital. I'd like to recognize, and I apologize, I didn't see them come in earlier, but Senator Frank Blas, one of my colleagues, and of course Senator Roy Kinata. Sidus Masi, senators, for being here with us. We'll now hear from the Deputy Director of Guam Public Defender.
Thank you, Madam Speaker and members of the legislature. My name is John Morrison. I'm the Deputy Director of the Public Defender Service Corporation. I wanted to testify in support of this bill today. I can tell you that I've personally lost clients to overdose throughout my career, and still think of them, remember those conversations that I had with them. So I believe that this bill would have targeted some of the exact circumstances that they found themselves in, that is an overdose in public and private places. There are some amendments that I would ask the legislature to consider, and potentially some additional legislation that may make things easier in practical terms. First, I think this bill does a good job of getting the drug into the hands of people that need it or would be in a position to administer it. That's family members of someone that's struggling with drug addiction, friends, first responders. I would also suggest that the legislature consider amending it to include hospice care workers and caretakers, because although they may not consider themselves in a position where someone that they're caring for may be overdosed, that may be the situation that they find themselves in. And I think by putting that specific language, it might cause them to think that this is a drug that they should get their hands on if they're caring for someone who is actually prescribed fentanyl or a strong narcotic. Also, there are a number of jurisdictions that have allowed anyone who asks for it to go into a pharmacy and be given naloxone. I think that this bill takes a more middle-of-the-road position, that this requires there be some connection, but I think ultimately there's little risk of abuse, there's little of a secondary or black market for naloxone, And I think if someone goes into a pharmacy, they're requesting this, there's probably a good reason for it, and they should be given it and potentially spare them the potential embarrassment or indignity of asking for it or explaining why they need it. I also think the legislature should consider the consequences for someone who makes the call. There are a lot of other jurisdictions that have granted some level of legal immunity to the people that make these calls. And these are going to occur in ways that aren't beautiful or perfect, but if two people are using drugs together and one person overdoses, I think the legislature should incentivize the person who did not overdose to call the police. I think they may think twice about doing that as the law is currently written because they could be arrested. So most jurisdictions have allowed some level of immunity, but there's sort of a balancing test there. It allows for immunity, for instance, for the possession of drugs, the possession of paraphernalia in jurisdictions that those are illegal. But obviously, if the police go in and there's a high-level crime or a murder that's taken place, GPD or law enforcement would still be in a position to arrest and prosecute there. So I think really incentivizing the people that may witness overdoses the most would really be a benefit. I'd point to Virginia that has a law specifically on that subject. It's Virginia Code 18.2-25103. Section B of that allows for that sort of a legal immunity that I was discussing. Last, I would say, as it's currently drafted, I don't take issue with the fact that training is required for this bill. It seems as though there's a number of providers here that are aware of that and would get right on it. Not every jurisdiction has seen that necessary. Some jurisdictions have allowed for an encouragement that people get training, but it's not required. I would take it that in those jurisdictions, the risk here is really dire and that they're really in the midst of an epidemic. So those are largely the comments that I have and the changes. I'd be happy to take any questions if there are any.
Thank you very much. Again, that's the Deputy Director of the Guam Public Defender Service Corporation, John Morrison. Just want to check if there's anyone else who intended to testify this morning. Please raise your hand. If not, okay, then I'm going to proceed with my colleagues, beginning with my Vice Chair, Senator Joanne Brown.
Thank you, Madam Chair. I appreciate it, but I'll extend the courtesy to my colleagues that arrived before me. Thank you.
Thank you. I'm going to go in the order I think that they arrived. Senator Chris Duenas.
Madam Chair, and I just want to thank the entire panel for coming out this morning and giving some very valuable testimony to the bill and how it should proceed. I think that with the testimony, if it is required, pertinent amendments can be placed, but I certainly appreciate all of you putting on the record the seriousness of having to get this moved forward quickly, because I think that's exactly why the committee has moved this forward. I think we have enough to work with. I don't have any major questions. Maybe I would go to Attorney Luther and say that in the testimony where it's recognized some concerns, do you recommend then including, because I know that behavioral health and wellness indicated that they believe that public health indicated that they themselves are along with behavioral wellness basically should be the lead on this. Do you think we should include GMH in terms of any degree of additional training?
Sorry, if you could turn your microphone on. Thank you.
Thank you, Senator Duenas. And that's one of the questions that I raised about the text of the bill, because I think that any healthcare provider in Guam Memorial Hospital is already obligated under the text to engage in training for any prescription or distribution or dispensation already. The question that I raised was that the law seems to require any Guam Memorial Hospital physician or nurse or any other person who's covered under the healthcare provider provision to give that mandatory basic training to a recipient, and that would also apply to the community-based organization employees and volunteers. I think that we're, the question that my physicians have had after looking at this is, am I required to give that training to those individuals who I have to assume have already received training, or to verify that they've had that training in order to avoid the immunity waiver provisions of the law. Right now, I think that if I went back and asked them, and again, let me place words in my physicians' mouths, that they would be fine with Guam Behavioral Health and Wellness taking the lead on that, and they would appreciate that they've taken the lead on that. I think that a one-stop area for the training is probably preferable. However, if we get to the point where we find that this is the epidemic that I absolutely 100% hope that it does not become, then we absolutely would be open to revisiting that issue.
Thank you, Mr. Luther. And I may not have read it in the text, but I know that recently also the speaker introduced, and we passed legislation in the last legislature dealing with the extension of medics and beyond now in terms of emergency response, in terms of their capability of administering too. So I think I agree with you on a single point of contact, and that we've already incorporated the coverage by physicians under other designated authorities such as mental health and behavioral health to extend that coverage to the frontliners when they're doing their job, particularly with the paramedics and other elevations that we've done in emergency response. So with that, Madam Speaker, I think we've got a lot of valuable information, and thank you for allowing me to make a few comments and ask a question. Jesus Masi.
Thank you, Senator. Senator Rujan.
Thank you, Madam Speaker. From public health, you had stated basically in the public health testimony that you would recommend, or public health recommends that behavioral health and wellness be the designated training facility for the administration of this. Do we have anybody from behavioral health that's here?
No, they're not here in person, but they submitted written testimony.
Oh, okay. That being said, I mean, I guess I'll just throw the question out. If you're recommending that they be the entity to train, do they have enough of the staff equipped, ready to train the masses that will require the training?
Senator, I had spoken to the Behavioral Health and Wellness Center prior to making this presentation, and they were already doing it.
Okay.
Yes, it's already in place, and I agree with the one from Guam Memorial Hospital that when the time comes and we do exceed, and I'm really glad that this bill came up because we want to do prevention and be proactive and not wait till it comes like we did with COVID. But when that time comes, I think all the agencies are going to step up to the plate. The other thing is, if you look at the professionals, they already have it within their training. So it would be those that are not, it's not included in their profession. So that's my discussion with the chief, with the health professional licensing office.
And that was concern of Attorney Luther here in regards to the non-medical professionals and their accessibility to this and the administering of this antidote here. And so they'll be prepared then to, because they already trained professionals basically in the medical professionals,
Right.
so they'll be prepared to train non-medical professionals in the administering of this this antidote, right?
I would also like to mention the chief, he talked about this particular box of, the nasal. And it's true, it's very clear, and it was made for the public.
Okay. One other question. It's not mentioned here at all, but maybe it is basically in regards to the immunity with the Good Samaritan immunity. But from my readings on some of the fentanyl that's been out there in disguise as candy and things of that nature, really concerned that it would hit our schools. That being said, will the principals or the nurses, because not all nurses, and we don't have nurses in all the schools at this point, and will the Good Samaritan immunity clause here be applied to those folks in the schools that may administer this to to minors? Would they have to, would students or parents have to give authorization to administer, if needed, to their particular student? Mr. Attorney General?
Senator Lujan, what I have a note here for is, like you're saying, the nurses and the SROs, school resource officers, they should not only have the ability to, have an inventory, but also the, the immunity associated. But quite frankly, the immunity should apply to all law enforcement officers and DOC officers. I believe there's a question whether DOC officers are actually considered law enforcement, but they clearly should have the ability not only to administer this, but to be immune in case there's a problem. So having said that, I think you are correct, Senator. It should be the nurses, SRO officers, because those are the first contact with the children if they start to show signs of an overdose. In the States also, the parents, I think Texas, they're actually putting in dispensing machines. But, we should maybe consider not just people that are prone to have that, like, drug addicts, things like that, but also your common parent.
Sure.
Because in the States, again, you're seeing those horror stories where the parent comes into the room and their child is minutes away from death. So, but I'll leave it like that.
Sure.
Thank you.
And at a meeting, of course, with the chief of police prior to being inaugurated into office, those are your concerns as well, the immunity, liability immunity in regards to one of your officers being able to administer to another officer, but if a civilian is in need, and would they be immune to that, that liability? So I think this bill covers that as well. But my own question, would parents, because of the immunity being placed in here, would the parents have to at first, because right now they have to give authorization to, I guess, the healthcare professional in that school to administer whatever medication is needed from the child?
I think when there's an emergency situation, the senators can consider those situations, but again, you've got the nurse, and then the SRO is a quasi-law enforcement type of officer. They, with the proper training, and I think that was very important, that once they're trained to detect certain things, they probably should be equipped to do the emergency intervention. Because from what I understand, it's within minutes that a person could be dead based upon this type of exposure.
And maybe one question, maybe to Madam Speaker, do all the schools have either a nurse or an SRO in the schools?
I don't think the SROs are available anymore. That was a grant program through the judiciary, and it's ended. The nurses, I'm not sure. I don't think they are. No, I think you're correct. They're not in every school.
So Senator, if I may.
Yes, Chief.
So they do have SAO, a school attendance officer, and I believe in that group there's also a couple of SROs, or school resource officers, because they were trying to transition an SAO into an SRO, vice versa. But they do have both titles, SAOs and SROs.
But all schools have at least a nurse. Oh, so not all of them.
They're primarily in the high schools, but even at that, I don't think they have enough to serve all the high schools. Yeah,
So
it's a very small group of people.
So we may have to extend that out to other professionals within a particular school.
But to your point, though, thank you very much for mentioning, and then to General Moylan, the immunity under the subsection for immunity. Unfortunately, first responder was not covered in that subsection. So I do ask again, like General Moylan did, that we include first responders into the immunity.
Thank you, Madam Speaker.
Thank you, Senators. So include first responders. Mr. Attorney General, yes.
Madam Speaker, with what the Chief has just indicated, probably to protect these people, these categories of people the legislature is identifying, there might be a consideration of first training so that they just don't have immunity to begin with, but each category would have to be trained first and then receive that immunity from that training. Thank you.
Thank you. All right, and Senator Fisher, my apologies. My staff informs me you were the first one here today. So
not at all.
You may proceed.
Thank you very much, and good morning to all. And thank you for coming down and testifying on this very important bill. I appreciate it, and I know that all of my colleagues do as well. I was largely course, we've all been hearing about the opioid epidemic for, I guess, some years now, but I was largely ignorant of the existence of Narcan and opioid antagonists until I met with you, Chief Steve. We had breakfast, I think, also with Senator Barnett, and you brought up the necessity for this bill, and I just wanted to thank you for showing that leadership. And I'd like to thank the Speaker as well as Senator Chris Barnett for also showing leadership in bringing this forward. I note that this is the first public hearing for the 37th Guam Legislature, and I think it's appropriate. What we are doing here is tackling a problem that is starting to wash up on our shores, and we are getting ahead of it. We are trying to get ahead of it, and this will not be the end of it. I note that the mayor of Inarajan, Mayor Chargaloff, gave us some written testimony, and in that testimony you can feel the concern and the anger that he has in that letter in general, because he is very concerned for his village and he's very concerned for the island that this fentanyl is coming up and starting to appear. Unfortunately, I think it was from you, Chief, we've had 2 deaths so far, and this is an attempt to get ahead of it, and I appreciate your leadership and the leadership of Speaker and Senator Chris. I think I can assure the mayor of Inarajan and the mayors of all the villages, I can assure them that this isn't going to be the last they hear of fentanyl, and it's not going to be the last they hear of legislation involving fentanyl. For some reason, we got behind the curve on crystal methamphetamine, and it has ended up being a rust in the entire body politic and societal nature of Guam. It's going to take a generation to extract that filth from our island, and now we are trying, through the leadership of many people in this community, now we are trying to get ahead of this next catastrophe. I have to add, I think it was Senator Jesse's question. He brought up the idea of school nurses as well as SAOs or SROs administering this, and I just spoke very briefly to Senator Joanne about it. I mean, you know, what a nightmare conversation, a nightmare. Can you imagine talking about the necessity of having Narcan in a grade school? You know, I hate to say it, but I guess we are there, and we have to be ready for that disaster. That being said, Chief, do you still have I see you still have the Narcan in front of you, right? Could you show us how the Narcan would be distributed using this product?
I'm sorry, how would we distribute it?
I know it's got, I mean, how would you use it if you run across somebody and they're on the floor?
Oh, I wasn't trained on administering Narcan. But I mean, if you open up the flap, it's a 3-step process.
Okay, could you actually extract the material from the box?
Yeah, so in the opening of the flap, you can actually, it takes you step by step on how to properly administer this particular type of Narcan. And so these are controlled. They have a serial number in the site. And so that's how we can control who gets it and what we do with it. I would like to point out, though, that Narcan does, this particular brand that we purchased, does have a very short shelf life.
Okay.
And we're looking at just a little over a year. We got this late last year, but it expires next year in April.
That's it. And I noticed that it has to be refrigerated to.
Yeah, it has to be, well, not necessarily refrigerated, but in my conversations with some of our officers, it has to be kept in a cool place. Yeah, so definitely not in the car, in the in the dashboard, maybe in their gear bag, or in the glove compartment. And when they're done for the day, it should be taken out of the car and either kept in their gear bag or in their locker if it's going to be assigned individually, or transferred to the next officer, pick it up at the desk watch for the incoming shift.
Okay, now, would an officer, I know that many of you haven't actually seen inside the box, but essentially it's 2 vials about the size of my pinky, and I believe that it's, sorry? Oh, no, it's 2 vials about the size of my pinky, and I believe it's inserted in the nasal cavity?
Yes, this is administered through the nasal cavity. This is a nasal spray.
Okay, just a nasal spray, and
there's two doses in here.
so is it 1 dose per victim, or?
This is, as man, yeah, I'm not sure about this one. I'm sorry, we didn't get properly trained. I didn't get properly trained in this.
Okay.
But some of our officers did receive awareness training from our officer assigned to the DEA task force.
Okay.
Yeah.
It looks fairly simple.
Yeah, it looks very straightforward. I mean, really, if you're carrying the box with you,
Okay.
it'll take you step by step on what to do
Okay,
with
so-
your victim.
So, and I noticed that it's done through illustration, so you don't have to be fluent in English. To
Yeah, it'll
figure
tell
out what
you,
you're doing.
right, the person's laying down,
Okay.
peeling it off, and then administering it through the nasal cavity. Yeah.
Okay. And, ma'am, I believe, Ms. Duenas from Department of Public Health? Have I got you, ma'am? I believe in your testimony you suggested that this drug should be administered intravenously. That would be your preference?
That one is for professionals and for immediate.
I'm sorry.
For immediate
Okay.
administration.
Okay. All right. But do you have any particular objection to the drug being used intranasally?
No, we don't. As a matter of fact, they were saying that for those that had not been trained, that
Okay.
this method would be better,
Okay.
and it can be used.
I understand. All right, just a couple more questions. Mr. Luther, first of all, we did receive some testimony written from the judiciary of Guam. They expressed concern that this legislation was going to cost them money, and they didn't seem to have the money. I think they misread the bill. The training on this is not done by the judiciary. I think that they just misread it. And then I wanted to ask Mr. Luther a question. You raised the 6108 section and your concerns about the immunity. And I think this is something that can be easily fixed in drafting, but could you explain your concern about the immunity?
Yes, thank you very much, Senator Fisher. The issue with immunity is a statutory interpretation issue that will inevitably come up when we're dealing with a potential lawsuit against healthcare professionals or community-based organization, volunteers, employees in the administration of this drug. The issue arises under the section of 16108, where the law states, unless the healthcare professionals, and this is the waiver provision, unless the healthcare professional's actions or the actions of the employee or volunteer of a community-based organization with regarding the prescribing, dispensing, or distributing the opioid antagonist constitute recklessness, gross negligence, or intentional misconduct. On the surface, that statement seems pretty innocuous. However, the inclusion of the language "or" may impute, or a court may interpret that it imputes the waiver provision to the healthcare provider or the community-based organization, employee, volunteer, based upon each other's engagement of recklessness, gross negligence, or intentional misconduct.
So if I'm a doctor and somebody working for me acts with gross negligence, I myself, the immunity that I may have had might be waived?
That could be an interpretation that a court may apply to this section, just because it appears ambiguous. It's a bit, and this is not a perfect relation, but it's a bit like products liability, where an individual is responsible down the line for a product all the way down.
Do you have a suggestion for fixing the language?
I provided a suggestion, and the best suggestion that I can come up with is to add more verbiage to the law, unfortunately, which is to split Section A into 2 subsections, would be A and B, providing a clear distinction between healthcare providers and community-based organizations, employee volunteers, eliminating the word prescription from subsection B, which would apply to the community volunteers. Under that interpretation, I think it would be pretty clear to a court that the individual's recklessness, gross negligence, and intentional misconduct imputes a waiver only to that individual and not to any other party.
Okay, I think that makes sense to me. I think that's a very good suggestion. And
Thank you.
I hope all my colleagues could consider that incorporation. And then, Mr. Morrison, I wanted to ask you a question. You said there, as I understood it, you said there was a secondary market for naloxone? What is that? I understand
think
what a secondary market is.
What I meant to say was that I didn't believe that there was a secondary or black market for naloxone, so there shouldn't be as much of a concern about putting it into as many hands as we can if there's a need for them to have it.
Okay, so I just misunderstood.
I probably misspoke.
Yep, so would you agree that naloxone has almost no propensity for abuse?
Well, I'm not anecdotally aware of one. I wasn't able to find any in any of my research. In fact, quite the opposite. It seems like I can't imagine people wanting to abuse this drug because it takes away the high that apparently they were seeking. So I don't believe that there is any real risk for misuse of the naloxone.
Okay. And then I guess my final question is back to you, Chief Ignacio. I know you reviewed the bill, and I think you probably had some input in crafting it. As a member of Guam Police Department, do you think this bill answers the needs of the men and women who work for you?
Yes, Senator Fisher, it does. Thank you very much.
Thank you. Madam Speaker, I don't have any further questions.
Thank you very much, Attorney Fisher. Senator Fisher. Senator Barnett.
Thank you. Thank you. I'd like to thank you all for being here today and providing testimony. Chief, good morning. Attorney General, good morning. I did have a few questions. There was a point raised about the ugly truth drugs in the schools. I know some middle school teachers, and they're telling me that they're finding ice pipes in middle school backpacks. So I kind of wanted to start there. I don't know if this is a conversation with you, Chief, or with just maybe other people, stakeholders in rehabilitation, but have you guys heard anything about crystal methamphetamine laced with fentanyl?
None that I'm aware of yet.
Okay. And how many officers have you had trained for the administering of naloxone?
We have 5 officers trained, mostly those that are assigned to the federal task forces. Yeah.
Thank you, Chief. Have you had a chance to maybe just stick your finger in the air and see how the rank and file officers feel about administering naloxone?
No, but I do know that there was some concern when I pulled it off the streets and put it back on the shelf that they didn't have this available for themselves, for one officer to administer the other, and also to the general public should somebody be experiencing a fentanyl overdose.
Well, that's good to hear. Some of the comments I got after we introduced this bill was, well, one of them was, we don't have an opioid epidemic on Guam. Why are we introducing this? But it was news to me that we've had 2 fentanyl seizures, one local, one federal.
Yes, that's my understanding.
Are you able to provide any more information on that?
Not at this point, sir.
Okay. And also 2 overdoses. That was very shocking, tragic.
Yes, we've had 2 recorded overdoses. Both survived, as far as my understanding. But yeah, we've had 2 overdoses.
What can you tell us about the presence of fentanyl and/or opioid usage, the prevalence of it on Guam?
Other than the 2 known seizures, there's nothing beyond that. Yeah.
Well, I think that's it. No further questions. Thank you. Yeah. Where's it? Oh, sorry. Where's it coming from? From the batches that were seized. Is it coming from the States?
Well, one was seized by customs, so I don't have any further information on that. That was a real quick conversation out with Director Pareto before I came in to testify. And then the other one was a federal seizure. Yeah. So I cannot speak beyond that. I don't know where they came from.
Was there any? Sorry, Chief. Was there any other follow-up? Remember, we talked about this in our meeting. The bust in, I think it was in MTM, where you had busted a bunch of bad guys with a pill press, and I believe it was suspected fentanyl, and they had an operation going with something with producing and manufacturing pills. Can you tell us what came of that?
Sorry, this is Captain Scott Waite. He's in charge of my Special Investigations Section.
Morning, Cap.
What? So it's my understanding that that case went federal. Yeah. So it's been adopted by the federal agency. So I don't have any further information.
Have you had any other local
No.
cases like that since that time?
None since then. Yeah.
Okay. Well, thank you for your testimony, Chief. And also, I believe Attorney Morrison, had you said something about Tennessee and the problem with opioid addiction there?
I think that was my counterpart,
Okay,
Mr. Luther.
sorry,
but,
Attorney Luther. So here's what I wanted to ask, because I'm familiar with Tennessee, and a lot of these eastern states have struggled with not only opioid epidemics now, but as well as crystal methamphetamine. So what is the trend with the addiction, maybe the drug users in those states? Are we seeing two epidemics running kind of parallel in terms of crystal meth usage and opioid usage?
So my testimony is going to be based upon my history working in Davidson County's drug court and dual diagnosis clinic and their community corrections. And so I have almost a decades that happened even before law school, but my experience and from what I've heard from members in the law enforcement community is that they are running tandem to each other. There are areas where meth is far more prevalent, usually in the mountainous region of Tennessee, in the lower income areas. However, the overdose problem has been linked almost exclusively to opioid abuse. It began as abuse of drugs like hydrocodone, oxycodone, and not the weapons-grade opioid that fentanyl is. But the problem has been, again, from what I've heard, is that fentanyl is making its way into commonly used opioids. It might come as no surprise, but the drug users, drug dealers, and drug manufacturers are not very scrupulous in what they put into their products. And so a good number of the friends of mine that I have in defense counsel practice in East Tennessee have told me that the opioids that their clients are distributing usually come in the form of something that is not supposed to be fentanyl, but contains trace amounts of fentanyl, which can still be deadly, and that's where you have opioid overdoses. An individual thinks that they're getting a pill of hydrocodone. It's been made up in a pill press to look like hydrocodone or some other prescription medication, but what it is that it's a low-grade prescription medication dosed with fentanyl in order to produce the illusion of a high.
Thank you, Attorney. Director Camacho, do you have any issues with opioids and/or opioid or fentanyl-laced opioids making their way into the prison as contraband?
None, sir. None, sir.
Thank you.
Thank you, Senator. Senator Taitzigui.
Thank you, Madam Speaker, and good morning to my colleagues, to our very first public hearing. And it's well received, too. I'm glad to see there's a lot of people here for such an important issue that we're facing in our island. And trying to be proactive has always been my forte, to work forward to that. And I really appreciate all the hard work, especially the group that's gone to, I guess there's a board that has been put together to address the situation. So let's not drop the ball on this, senators. Let's keep this throughout this whole term and find a solution or find some help for our community. That being said, we really hoped that Department of Public, not Department of Public Health, but Mental Health would be here this morning on something so important, and instead of providing just a testimony, most of my questions are to behavioral wellness. But unfortunately, they're not here, Madam Speaker, so I will request that my questions be brought forward to them.
Would you like
I do have one. Well, one of them is, why would they want to take away the training in their letter from Department of Public Health and Social Services. Mrs. Duenas, they said to remove this department as a training provider. Is there any reason you would agree to this? Is it something that Department of Public Health and Social Service can train? Because here, I don't even see a cost in training, too. I mean, who's going to provide this training, and do you see any cost associated with providing this training?
There will be a cost if the Department of Public Health and Social Services takes that training. And because it was already in place with the Guam Behavioral Wellness Center, we felt that we would support that at this time.
You would support it, but is there any reason why public health couldn't offer that training as well?
Like I mentioned earlier, we're prepared to help, but I think the lead, because they're already doing it, would be best at the behavioral health.
Sometimes we're finding that when individuals, our community is going to certain agencies to get any kind of assistance, they're backed up, there's not enough people, there are people not answering the phones. So, to finding an alternative, I think is something important as this opioid, addiction that we're finding on our island right now. I think having another entity to provide this kind of training, I think it's important enough to have it. Can you kind of give me a guesstimate at how much this would cost, or is there opportunities for grants available if you were to provide this training?
I think that's why Guam Behavioral Health and Wellness was looking at being the lead, is because they do have SABSA, who they can get grant money for.
Can this money also be given to Department of Public Health as well to provide a second source of training an area for a second training
I believe
facility?
that we could be added on to the Guam Behavioral Health and Wellness grant, but they would need to get approval from their federal partners.
Okay, thank you. Is Narcan under a controlled substance list? Maybe, Chief, is that under a controlled substance list?
Yes, and that's why we're here today.
And is Narcan considered dangerous? Can you overdose on Narcan?
I'm not a medical professional. Yeah,
Is
but
there
I do know
anybody-
that
is there
that
anybody here
the
that-
ingredient,
yeah.
naloxone, is listed currently in our Schedule 2 controlled substance.
Right, but can
That's
you
why we're here today.
overdose on that? Like if someone were to take this and put it in their nose and, squirt it in there and then nothing happens and they do it again? I mean, is there any kind of danger to it? Can you overdose from that?
I'll defer to a medical professional, yeah.
Does anybody know? Attorney Morrison, you've always been my go-to person, so do you know if this is
Senator,
can
I
be
would-
harmful?
I would defer to the medical professionals,
Okay.
obviously, but in my researching it, I was unable to find anything that indicated that there's a risk of overdose. In fact, it looked like if a sober person takes it, it does nothing. If someone takes it as a prevention before taking opioids, then it's going to reverse that, or if they're in the midst of a crisis, it's going to reverse that. But I didn't see any indication that there was overdoses associated with it or negative health
Or an
outcomes.
addiction to it? Nothing
Definitely
at all?
no.
That's why it's just so confusing. Why would this drug be under a controlled substance? I mean, there are worse drugs that are over the counter, that can be distributed. So I'm just kind of curious as to why this is the case. I mean, in Guam law, we can change that, of course, taking it out of the controlled substance list and put it on, but I didn't really see an issue with this because, yeah, I've did my research too, and I've seen that it really is not harmful, but only to help individuals. Attorney Morrison, you mentioned earlier about certain jurisdictions that have laws regarding, the use or the process of using these, as well as fentanyl strips too. I guess that's also an alternative that was actually in Guam Behavioral Wellness. What jurisdiction would you recommend that we look at closely to mirror Guam law?
So, as it's proposed, I think this basically takes a middle-of-the-road ground. I think it basically depends on is the epidemic here? Are we suffering currently? And I think some of these jurisdictions that have taken a more a more aggressive approach, sort of putting it into the hands of anyone who wants for it. I think, unless I'm told that there's some risk of abuse or overdose from Narcan that I didn't know about, it seems like a good idea to have it in the hands of as many people that want it as possible.
Right.
And although there's a requirement for training in this bill, not every jurisdiction has adopted that. Some encourage training, think it's a good idea, but that the epidemic is so great that the risk of doing that is not worth it, that we should just really get it out to as many people as we can. So I think this bill is good. It's a middle ground bill. I think it addresses the situation that Guam finds itself in, but I think if the news changed quickly, some of those other ideas would come into place, and there's a number of jurisdictions that have adopted various portions of what I've discussed.
But any jurisdictions in particular?
Well, I think the additional statute in Virginia that I talked about would be a good idea. There's a lot of jurisdictions that have adopted some level of immunity for the people that are really likely to actually see somebody overdose on drugs. Those are people that are using drugs as well, but are not suffering from an overdose, and that they may hesitate to call the authorities because they're afraid of being arrested for possession, they're afraid of their probation or parole being revoked, and they basically just wait and see if this person is going to come out of it or not, and when they do that, it's too late.
Okay.
Well,
it's also no, oh, go ahead, please, Attorney.
Pardon me.
Attorney General.
John. Just to give the government's point of view, people should not get immunity for reporting a crime. The scope of the immunity that's given should not prevent the law enforcement officers and the Attorney General's office from prosecuting them for having created that situation. So administering it, that's a civil type of immunity. But prosecutorial, the idea that you were taking drugs or engaging in some sort of third-degree felony possession, I don't believe John's saying that. I hope he's not saying that. But that's where, from the AG's office, we would oppose that type of immunity.
I'm saying that. Yes, that's my proposal.
Just to clarify, so in other words, Attorney General, is the individual, let's say the individual is calling emergency because someone is ODing, and find out that individual is the one that gave them the pills or sold them the pills, or gave it to them. And
that type of immunity, I don't think John was...
I'm not proposing that type of immunity,
okay.
And most jurisdictions don't. We're talking about possession, or we're talking about possession of paraphernalia,
right.
The giving the drugs, or creating or committing a more serious crime that the police are exposed to because they come in is different. But I don't believe that there should be arrest for possession of Good Samaritans that phone the authorities.
This is where I think the nuance is going to have to be made. A person that's giving the drug and then the person dies because you gave them too much of the drug to try the antidote, that is the immunity I'm talking about. But the fact that you had drugs on you, that you two were enjoying that drug, I don't think any immunity should be given for that. You've created the situation, and you should be held accountable criminally for that situation. It shouldn't be a get out of jail free card.
Yeah,
that I'll just call the cops, and then all this is going to be wiped away. So if there's a nuance there, the only nuance I'm saying is immunity should be associated with the administration of the antidote,
right.
and whether you can be sued for it. And that's a civil type. Even the criminal type of doing that, negligent homicide because you gave too much antidote. Other than that, that's where we would oppose it.
Well, I'm glad we had this conversation to clear this up, because I'm definitely sure that many of us here are going to look at that particular immunity issue on the legislation. Well, I think that's pretty much what I have right now, and appreciate again your time. And I truly believe that because it's not harmful, these spray kits are not harmful. I mean, it has directions on it. I think FDA sooner or later is going to probably allow that to go over the counter, and anybody can pick it up at their drugstore, to provide it. I mean, it's a way to save a life, and I think that it's something that's going to probably move forward very shortly with the FDA. So But I'm glad that we're moving on. It's being proactive, so let's move forward with this. Okay, thank you so much.
Thank you so much, Senator Taitzgui. Again, thank you to all of you for the testimony. I'm really glad that you came and demonstrated the relevancy and the urgency of this type of a measure. And I didn't know. Sorry, Senator Brown? You were first. Oh, okay. I invited you first, Senator, but you may, yes, please proceed.
Thank you very much, Madam Speaker. I just extend the courtesy to my colleagues that arrived before me. I just think it's proper. But I do want to thank all of you for coming to testify. You know, when I was thinking about this bill when it was originally introduced, it was another clear reminder of how prevalent our drug problem is in our community. And certainly those of you in law enforcement that are involved in every aspect, all the way down to incarceration of individuals that have been involved in bringing drugs or selling drugs in our community. It's very concerning, all the way down to we're talking about the impact of our children in our school system that could be receiving these drugs that could be harmful to them. I have no argument about the need to provide this legislation and provide this resource so that those that are in a position to administer it certainly can help save lives in our community. But again, it's very concerning that we're having this discussion, even more so collectively, that all the key parties here involved in our law enforcement aspects are concurring on it. And that's something we really need to do some deep thinking about in terms of our role as legislators, all of us in our community, about what it is we're doing to actually reduce the challenges that our people are facing, especially all the way down that we're worried about children in our high schools, our middle schools, our elementary schools could be adversely affected by this. You know, it's like saying there's no drugs coming through the port. There's drugs, the fact that they're coming into DOC is problematic because, you know, we have people that are hired specifically to keep drugs out of the prison, but, you know, it's still happening. And how challenged we must be, how all of us in our community are challenged for those that we love and care about to protect them from the dangers of drugs that are coming, especially drugs, as you mentioned. We don't know what's in it. You know, you're assuming your dealer's giving you something good and, you know, I'm going to get a high this afternoon. And, you know, the fact that many of our people feel a need with their circumstance to be in an altered state of existence is concerning. Because Guam's good. I mean, I love living here. My dad's from the state of Tennessee, by the way, Tracy City, which I've had the opportunity to spend some time in, but the Browns are from Tracy City, Tennessee. But I agree with you, that's been a prevalent problem there, and now it's reached our shores, and what can we do collectively beyond this to really address this from enforcement, awareness, and treatment in our community so that we can get our people back and get our people focused on the good and promising things that we have in our community. I don't have a problem, as I mentioned, I do appreciate the efforts of our speaker, and certainly Senator Chris in introducing. Hopefully you consider us as co-sponsors, us remaining members of your panel that are still here this morning. But with regards to the parts, I think there's several things that we do need to go back as a committee before we put this bill on the floor. Definitely, I think how we address the immunity, the concern you raised, AG Moylan, to what level do we address that so that we ensure that those obviously that are doing these illicit things are brought to justice. And I certainly appreciate the stand you've taken in your run for AG and coming back to the Office of the Attorney General to make sure that we have prosecution. Because I don't want people to think that as a result of doing this, we're somehow condoning the drug problem that we have on our island. We definitely want to see prosecution. We definitely want to see those that are responsible for this. Because right now, you know, they're strolling around our community as if they are the top level of our social stratosphere here. We know it, we see it, we know who they are. They're legitimate business people now. I mean, now they have a way to properly launder their money, and that's very scary, the fact that things are at that level. So we do need to discuss, and I agree with Senator Tello, we do need to have feedback from behavioral health in terms of their capacity to do the training because, you know, we just had them here recently. Our speaker just had them here to talk about their programs and get an update. But we understand, too, that they are they're stretched with regards to their personnel. So we'd like to know also to what degree they have resources to put aside to do the training. And I just want to follow up, Mrs. Duenas, with public health. Are you prepared, though, in the event if there's a need for additional training resources that behavioral health is not able to accommodate? Because we need to also get a clear idea of exactly how many people are we talking about. Is it every officer in the Guam Police Department, every officer at DOC? I mean, what numbers are we talking about and how soon can the training be given? I mean, it's almost like we want to get this to a level of awareness in our community, like getting trained for CPR, for example. So I wanted to get your feedback on that as well.
I will need to get back to you on that, but right now we're so stretched with all the things that we're doing, and just to keep the COVID testing and vaccination and going to the homes have been very difficult. So we'll get back to you on what we're going to need.
I appreciate that, and again, I mean, I think it's a very important bill, and I think we'd like to address it expeditiously, but I think having those questions answered before we get the bill on the floor would be very helpful, so that we don't have any further questions with regards to that. And as you know, Madam Chair, just in terms of the capacity, so that we know the training is available for GPD and others that want to pursue and have this training. With that, I have no further questions. Thank you, all of you, for coming. Really appreciate your input this morning and providing a little more enlightenment in how we can move forward with this bill. Thank you very much, Madam Speaker.
Thank you, Senator Brown.
Madam Speaker, may I just
Yes,
Chief
Camacho.
I noticed that, of course, we were talking about the law enforcement, so there's more clarity. Could we include peace officers?
Peace.
Because there's 3 categories of that, and you know, some like I'll give you an example. Like at DYA, they're not law enforcement, but they are peace officers, and they, you know, they might be in have situations where they have to use that Narcan.
Appreciate that, because
right.
we do want to include DYA. So we will run that language by the AG, the peace officers versus first responders versus law enforcement. So now I think we're more inclusive with peace officers, is what you're suggesting.
That's what I.
Thank you. All right, thank you very much. Again, that concludes the testimony and pretty much the panel's questioning. I don't have any questions except for one point I want to raise with Chief Ignacio. Again, this is a lot. This bill has a lot to do with your recommendations, and I did not know when we introduced the bill that we already had fentanyl overdose on Guam or seizures. And I would just suggest, as a layperson, that the more info you put out there about especially the overdoses, the more concerned the community will be, and take precaution, right? And if you have any advice regarding precautions or how to, you know, be cautious, and or just for parents and everyone else involved to be more vigilant, for us to help you in this regard. We don't want to see deaths. We don't want to see overdoses, and whatever other defensive actions that we can take besides treating the actual overdose, that would be appreciated, I think. Did you want to say something?
Yeah,
Chief?
so
Yes.
in defense of the Guam Police Department, we were only made aware of the overdose because it culminated from an investigation. So at times we don't know that an overdose is related to a drug investigation until we get our feet wet. And sometimes it's vice versa. We know about drugs because of an overdose. So, yeah, so we don't always talk openly about what we know because sometimes it's part of an ongoing investigation.
I see.
Yeah.
All right, well, I appreciate that.
And if I could just jump onto the end and help defend the Guam Police Department.
Please,
because
I'm
many-
not trying to,
No.
I'm not being critical, I'm just suggesting the more we know, the better for us. Please,
To add
Attorney.
another layer to this, many of the overdose issues that Guam Police Department, because I'm aware from being a prosecutor and from working at Guam Memorial Hospital about one of the cases that I believe Chief Ignacio is referring to, there's a HIPAA issue involved with Guam Police Department's receipt of that information, and frequently they find out, in at least one case, GPD found out about the overdose after the individual had been admitted to Guam Memorial Hospital in that dosing within, I believe, the last year. So there are medical records and HIPAA concerns related to releasing that information, which is why Guam Memorial Hospital is reluctant also to issue that information.
All right, so, Attorney General.
Madam Speaker, you may wish to consider having our medical examiner have a reporting requirement to GPD and the AG and the legislature as the medical examiner does the toxicology, which I know is a focus right now for grants and other things. But that would be a good place to have a disclosure requirement if they're finding this.
Thank you. And that capability is possible?
Yes, yes.
Okay, thank you.
They're,
All right.
the new medical examiner is doing toxicology actively now.
Okay, great.
Thank you.
All right. And I think there was a request for increased funding for toxicology testing so that they could be more prompt. All right, I appreciate that. again, thank you for bringing the urgency, bringing the information that you've brought. Thank you, and the relevance, and explaining to the community all that you have this morning, and the details regarding fentanyl that we did not have, in fact. And so, yeah, hopefully this is, we're ahead of this, and we can do as much as we can to prevent death. That's the #1 goal, preventing deaths from overdose. On opioids, we want to grant our first responders or our peace officers who are responding, those first responders, immunity so that they can give this anti-overdose drug immediately without repercussion. We have training available according to behavioral health. They are ready. They've received a grant, and I want to commend them for getting this grant and taking that proactive step, getting the NALOXONE on Guam, getting the capabilities to do training, and they have volunteered in their testimony to do training and proceed immediately if this bill's passed. They've also, we've also heard from Attorney Nishihara that the opioid settlements also condone that naloxone or opioid antagonist be put out into the community as much as possible. That's part of the settlement, and that settlement money might also be used to increase training if that's necessary. So we are able to look at that as well with the Attorney General's office. And I think the best news of all is that this naloxone, their Narcan, is on Guam. And so thanks to the efforts of the police department, it's on Guam and is available. The efforts of behavioral health, of course, at GMH. And so we are just going to hope to extend the availability and make it immediate. I will look at all the recommendations that were made by each of you, and I want to thank you for putting them in writing, especially those technical ones from GMH, and I appreciate that regarding liability, immunity, and the other ideas from other states that are facing more serious or more cases, and so we will definitely look at that. I want to ask, I'm going to talk with public health and maybe GMH and further regarding, are we trying to grant immunity for all types of dispensing of this drug, or just simply the nasal spray and there's another one, is it the injection, or we're not going to grant to the injection, the IV? For all of those. Okay, so according to the Attorney General, we will look at all of those. And all right, so if anyone has any additional testimony to provide, please do so. We will continue to accept testimony until 5 working days following this hearing, which is Monday, February 6, 2023. Testimony can be sent via email to Senator terlajeguam@gmail.com or hand-delivered to my office here at the Guam Congress Building. This public hearing is now adjourned. Todos.